Okay, so we have Dennis Sonicki, 59-year-old male who has been admitted with congestive heart failure and diabetes. The provider just wrote an order for a one-time IV push medication, though it has not arrived from the pharmacy. His breakfast tray has not yet been ordered. Verify his medication orders in the MAR and administer all available medications due at this time. Document your care. Perfect. I'm gonna set that over there. And so I'm currently on my provider orders, and I'm gonna go ahead and do my 5 rights first. So that one they said wasn't available yet, but it looks like he's got an insulin glargine available for today. So let's go check my MAR. There we go. Yep, that's the same medication. I'm gonna go back to my provider orders. 17 units. So medication and dose was right. Subcutaneous, let's check that again. Subcutaneous, perfect. And it's for Dennis, which is what I read on the beginning paper. I'll double check the provider charts one more time for that one too. Yep, still Dennis. And then let's check the time back on my MAR. It says 9 on Sunday, it's 8:17. So by the time I finish preparing, it should be within the 30 minutes before or after. So now I'm gonna check. It looks like he has metoprolol due at 8 on Sunday, so we're still within the 30 minutes after, which is good. Let me go check the other medication. It's Dennis again. So Dennis here, that's good. And then here it is. Metoprolol right there. So patient medication was good. Let's go check the dosage again. $50 milligrams. Here it is, 50 milligrams dosage. So we did patient medication dosage. Let's check the route. Oral. Okay, by mouth, perfect. So that's the same. And then, like we said, our timing should be okay, but I will go back to it one more time. Yes, Sunday, and it's still within our 30 minutes, so that's perfect. So now that I did that, I am going to go ahead and check out all of my medications. So I'm going to grab these really quick, and I'm going to do my 5 rights again. So I'm going to compare it to my MAR. So I have the right patient. Let's see, my medication should be good. So patient medications, check my dose, 50 milligrams, so I don't need any more tablets. It's a tablet all the way down there, which means that's oral, that's good. So we did patient, medication, dosage, route. The time's still good, and we just need to check our expiration, which expires on 2026, and today is November 28th, 23, so we're good on that one. And then I'm gonna go ahead and check my insulin. So right patient, medication, insulin, glargine, Lantus, perfect. We'll check our dose, which we can pull from here, and I'll have another nurse check later as well. Patient, medication, dosage, route, subcutaneous, which is a liquid, which looks clear, which is good, not cloudy, which is what we want. And then 9 a.m., we're still within our time. The expiration on this is good. It's not till 2026, and then our 28-day expiration expires tomorrow, so we are good to use it today. Perfect. So I'm gonna go ahead, now that I finish my 5 rights, I'll go ahead and go back and prepare my medication. And then I have up here too on my computer all of my reactions. I looked up these to make sure I understand both the metoprolol and the insulin so I can educate my patient. So I'm going to go over here and come prepare my meds. And just some hygiene really quick. And then I need a med cup for this. And I'll use that when I go in. And for my insulin, I need my alcohol swab, my pen. Open this up and scrub for 15 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Beautiful. Just gonna let that dry and open this up, which I have my SafetyGuide insulin pen. Perfect. That, set it down flat, pull back my ear to what I need. While it's flat, I'm gonna insert it, insert my air, flip it, and then pull my drug. And then I'm just gonna push back until I get what I need. Okay, and then I'm gonna have my second nurse confirm.
Yes, that is 17 units of Lantus, and it's not expired, and that should be good.
Perfect, okay. And this is when I would have her initial NMR that I have the correct dose. So I'm gonna take that out. My Metoprolol. Cap that, and then I'm going to go ahead and take this all into the patient's room with me. So, here I go. Hi, Dennis, how are you?
I'm good, thanks.
Oh. Awesome. I'm Celia. I'm going to be your nurse today. I am just going to ask you for your name and date of birth for me really quick.
Dennis Zotnicki and 59.
Perfect. It says you have no known allergies. Is that correct?
Yeah, that's correct.
Okay. Perfect. I'm going to close the door and the curtain for some privacy really quick. Dennis, we have orders for some medications. We're going to give you your insulin injection for the day and then your metoprolol. And I'm going to go ahead and give this to you one by one. We'll start with your metoprolol first, and I'll explain to you these medications as we go along. Does that sound okay?
Yeah, that's fine.
Okay, perfect. I'm going to go ahead and lift you up in bed. So sorry, sir. Let's get you comfy. There we go. That should help you take the pill. Great. So I'm going to grab this. And I'm going to do my 5 rights one more time, and then I'll come over and chat you up. So we have patient Dennis, and I checked his med, and then let's see, right medication, 50 milligrams, 50 milligrams, oral. It's a tablet, and then it's still within our time. We have 8 o'clock on Sunday, and it's within our 30 minutes. Perfect. So let me take this out, and then I'll come give you a little chat. Okay, I just have to scan this really quick. Perfect. And then the medication. And this is just another check to make sure that we have the right thing. Look at that. Beautiful. So we have, let's see. Let me grab your water. So, metoprolol. This is for your heart failure. What we'll do is it will help to lower your blood pressure and lower your heart rate. When we lower those things, it means that your heart doesn't have to work as hard, which makes you feel better. However, some of the side effects of this medication can include feeling lightheaded, dizzy, right? Because it lowers your blood pressure. So what I need you to promise me is that if you ever feel these side effects, that you'll press your call light. Does that make sense?
Yeah.
Promise me you'll use your call light?
Yeah.
Perfect. Okay. This is, like I said, an oral medication, so I'll have you swallow it. Don't chew it from me, okay? Okay. Here we go. Here's that. And your water. Just lift your tongue up for me. Perfect. It's gone. And then I'm just going to go ahead and document really quick what I taught you about the medication, and I'll stand here in case you feel funky at all really quick. Patient educated on signs and symptoms, on side effects of medication, including dizziness and lightheaded. Patient stated that they understood to use the call light upon onset of signs and symptoms. And then I'm just gonna initial that and save it. Okay, and we're ready to move on for your insulin. So I've got this back here, and I'm just gonna double check this one more time. It's the right patient, and we'll double check that too when we scan. We have our, let's see, patient, it's the right medication. The dose was, oh, down here, sorry. The dose was 17, which I had another nurse verify. It's a liquid, which means it's subcutaneous, and we are barely making our 30-minute mark. Perfect. So I'm gonna go ahead and scan everything again too. Oh, I have to click this first. Huh. Always tricks me. Okay. And then I'm gonna go ahead and grab, oh, I didn't do that. Hand sanitizer. It's okay. It wasn't the needle, so we're fine. And then that. Perfect, and everything's verified. So I'm gonna just do hand hygiene, grab my gloves, and then we're gonna give you the shot in your stomach, right by your belly button. Sound okay?
Yeah, that's fine.
Okay, perfect. Let me grab my gloves. Grab the oranges. That's not what I need. Jokes, everyone. Okay. And I just need my alcohol swabs. So I'm just gonna lower your head a little bit just to relax you while we administer. I'm gonna go ahead and take your sheets down. So insulin. You have diabetes, which I'm sure you've known about for a little bit. Insulin is basically something that helps lower your blood sugar. So this is your baseline dose, as I'm sure you know. We'll give you other doses throughout the day when you have meals. That will help correct your blood sugar for meals. But this one is just your baseline throughout the day. But as it lowers and helps your blood sugar, you can also experience signs and symptoms of hypoglycemia. So that can be feeling cold, maybe you have the shivers, you get kind of clammy and lethargic. So if you ever feel like that, you're gonna have to use your call light again to let me know and I can come help you. Does that sound okay?
Yeah.
You'll use your call light?
Yeah.
Okay, perfect. So I swabbed and let that dry, and it's 2 inches from the umbilicus, and it's gonna be in his left upper quadrant. So we're going to go ahead and uncap, just making sure I know where the sharps were at. Okay, and I'm going to go ahead and squeeze right here, and you're gonna feel a slight pinch. Okay, ready?
Yeah.
3, 2, 1. I'm gonna deliver this slowly and uniformly. I won't push it in too fast. Okay, and we're gonna count for 10 seconds together. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Perfect. Cover you up really quick. Get my sharps right there. Awesome. Let me just grab all my garbage. Throw this away. Hand hygiene. Oh, that's confusing. Okay, perfect. And I'm just going to document really quick while I stay in here with you to make sure you feel okay. As it 8:26. Patient educated on the symptoms of hypoglycemia, including feeling cold, clammy, and lethargic. I think that's not right. Nope, it's okay. Patient stated they would use their call light upon onset of signs and symptoms. Administered in patient's left upper quadrant. CT. Save. Okay, and I'm just going to make sure that your bed is in a low position. because I'm so short. I'm gonna lay you down because you said you wanted to rest before breakfast came. So bed is low. The wheels are locked right here. I would normally have just these two side rails up, but these are okay. And then your call light is right here. And I'm just gonna go educate on your safety notes that I just made really quick, and then I'll be back in 20 minutes after your breakfast is delivered to check in on you. Does that sound okay?
Yeah,
Okay, perfect. Thanks, Dennis.
thanks.